Good afternoon, everyone. Thank you for joining us today for today's webinar on the Walk Cares Fund. We'll give it another minute here just to let folks join us, and then we'll go ahead and get started. All right. Good afternoon, everyone. Thanks for joining us. It is 1 o'clock, so we'll go ahead and get started today. So thank you for joining us for today's webinar. Today, we'll be covering Walk Cares Basics, what workers need to know. My name is Sebastian. I am one of the Outreach and Language Access Lead for the Walk Cares Fund. We are also joined today by Logan, who is the other Walk Cares Fund Outreach and Language Access Lead, and together we'll be hosting today's presentation. The DSHS customer care team will be answering questions in the Q&A function throughout the presentation, and will also be joining us later for the Q&A portion of the webinar. So anyone who has joined us on a computer, or if they're maybe you're using the Zoom app on your phones, you can submit your questions through the Q&A function at any point in the presentation. And if we're unable to answer your questions during today's allotted time, you're also more than welcome to email us through our Contact Us form at walkcaresfund.wa.gov/contact, and we will provide a response there. Today's webinar will be recorded, so the recording along with the slides will be available on our website, walkcaresfund.wa.gov/webinars, within 24 hours of the completion of today's presentation. And with that, I will pass it to Logan, who will start the presentation by defining long-term care and caregiving.
Awesome. Thanks, Sebastian. I appreciate it. We'll go to that first slide there, and we'll talk about long-term care. Long-term care is help with activities of daily living, like bathing, eating, moving around, managing medication. It does not include medical care, like doctor's visits or treatments for medical conditions. Long-term care isn't just for older people. It can also help younger people with disabilities, injuries, or severe illnesses. And a lot of people think long-term care means living within a nursing home or assisted living facility, but it can also include in-home care and many other services like home modifications, home delivered meals that help you live at home as you age. In-home care can support your mental and emotional health in addition to any physical help that you need. There was a 2025 study that showed that home care significantly reduced symptoms of depression for people receiving care, improved their quality of life, and lowered their risk of loneliness. With the right support, most people with long-term care needs can help living independently in their own homes. It's also very common for family caregivers not to realize that they themselves are a caregiver. You might go to your mom's house a couple times a week to cook meals, drive her to and from appointments, make sure that she's taking her medications, which are all common care activities. In fact, most of this type of care is provided informally as unpaid care from a family member, friend, or a neighbor. Next slide. The reality is that we're all at high risk of needing long-term care at some point in our lives. Studies show us that about 70% of us will need some type of in-home care or long-term care in our lifetime. And that risk comes with a very high cost. Getting 20 hours of home care per week for 6 months costs around $23,000 in total. And even if you do have a family member to provide care, it's important to keep in mind the devastating financial impact family caregiving could have on them. And because long-term care is not medical care, it's not covered by most health insurance or Medicare, except in very rare circumstances. It's typically only covered by Medicaid after you have spent down your life savings to around $2,000. Next slide. The reality is that paying for long-term care is a problem faced not just by those lower income families. Most of us don't have enough retirement income and savings to live comfortably, much less to cover the high costs of long-term care. Even if you do have some retirement savings, very few people have enough to get by. 41% of Washington workers near retirement have no projected retirement income from a pension, 401k, or IRA. Another 42% have no pension and only enough 401k or IRA savings to replace less than 10% of their pre-retirement income. So that means over 80% of us don't have enough savings to pay out of pocket for care as we age. The median household income for seniors for 65 and older was just around over $69,000 in the year of 2024. So a public insurance program like the WellCares Fund gives workers a more affordable way to pay for their long-term care needs by allowing them to contribute while they're working when their income is higher. Then they can access money to pay for the care that they need later on in life when they're on a fixed income. So covering all workers also helps keep those contributions low, and once they retire, the contributions will stop. This approach to paying for long-term care is more affordable than private insurance at the time when people need access to care. And unlike private insurance, which typically requires you to pay out of pocket for 90 days before you can access benefits, WellCares has no deductible or waiting period. Next slide. And so to earn the WellCares Fund benefit, most Washington State workers automatically contribute 0.58% of every paycheck during their working years. You only contribute while you're working. Contributions began in July of 2023. Everyone is covered at the same low rate, regardless of pre-existing conditions. You'll need to meet a contribution requirement and a care needs requirement. Once approved, you can get to choose on how you want to utilize your benefit. Full benefit amount starts at $36,500 and will continue to grow with inflation. You can use your benefit for any covered services and supports that you want. There's no out-of-pocket costs when you need care, and we pay providers directly for those services that you receive with no copays or deductibles. Next slide. So you're here on this slide. This is what the contributions will look like over the course of a career. That typical worker in the state of Washington earning around $59,000 a year, they will pay $29 in contributions per month, which adds up to around $10,000 total over a 30-year career. To earn less in benefits than you will contribute, you'd have to make on average around $210,000 each year for 30 years. Next slide. Almost all Washington State workers contribute to the WellCares Fund. If you don't work in the state of Washington, you won't contribute. Federal employees are automatically not included. Exemptions for temporary workers with non-immigrant visas are automatic unless the worker tells their employer they want to participate in the program. Self-employed workers are only included when they choose to opt in, and employees of tribes are only included if the tribe chooses to opt in as well. Some workers who've had private insurance when the program launched have an exemption and do not participate for a limited time. This group can also choose to opt in to the program as well. As the table on the right shows, other workers can get an exemption from WellCares if they apply through the Employment Security Department. Some optional exemptions are based on meeting certain conditions, and you must continue to meet them to keep your exemption. This includes workers who live out of state, spouses of registered domestic partners of active duty military members, and active duty military members who also work a civilian job. And for those veterans with a 70% or higher service-connected disability rating can also choose to apply for a permanent exemption. For details on applying for exemption, you can visit wellcaresfund.wa.gov/exemptions. Next slide. If you're self-employed, you can choose to opt into the WellCares Fund and protect yourself with the same affordable benefits available to other Washington State workers. Like other workers, you can contribute 0.58% of your net earnings in any gross wages. To earn benefits, you must work at least 500 hours per year. You must opt in within 3 years of becoming self-employed for the first time. Applications to opt in become available in July of 2023. You can learn more on our website, wellcaresfund.wa.gov/opt-in. Next slide. Everyone who has contributed to the WellCares Fund more than 500 hours per calendar year is earning benefits. So this includes those part-time, temporary workers. To qualify for benefits, you need to meet the contribution requirement through one of our 3 pathways. First is what we call the permanent pathway. This will earn you lifetime access to the full benefit amount once you've contributed to the fund for at least 10 years. Next is what we call the temporary pathway. This will earn you access to the full benefit amount if you contribute to the fund for 3 of the last 6 years at the time that you apply for benefits. This was designed for people who have contributed recently at the point that they need care but haven't earned a permanent access yet. In 2026, applicants who've contributed for 3 years at any point in the program can qualify through this pathway. Next is what we have it's called the transition pathway. This will earn you permanent access to 10% of the full benefit amount for each year that you contribute if you're born before 1968. So for example, if you contribute for 2 years, you'd earn 20% of that benefit amount, or roughly around $7,300. This is designed for people near retirement as a program launches, who might not be able to earn permanent access to that full amount. These workers can also earn the full benefit amount if they qualify through another pathway. Next slide. To use your benefits, we must determine that you need help with at least 3 or more activities of daily living and will continue to need help for at least 90 days. The activities that we consider are bathing, bed mobility, transferring, toileting, mobility, eating, and medication management. We'll count any activities that need supervision to complete, like someone monitoring you, reminding you to start or keep going with an activity or task, or helping you set up. Next slide. When you're ready to apply for benefits, you'll start by creating an online account. If you need help managing your account, you can set up an authorized user, like a loved one or representative. You can also get help with your application from your local AAA, your area agency on aging, or call us to apply over the phone. Once you submit your application, we'll confirm that you've met your contribution requirement, and then you'll be able to schedule an appointment to talk about your care needs. After we meet with you, you'll let your approved one to start utilizing your benefits. Next slide. Now there's 2 different steps to creating your benefits account. First is what we'll use as a state secure Access Washington system verify your identity. And you can use an existing account or create a new one. And once you've logged into your account, you'll be able to add a WellCare's benefit account as a service. This will direct you to set up your benefit account. You'll enter your name and basic information, like your address and date of birth. And you'll also let us know what language you prefer to use and how you want us to contact you as well. Next slide. Once your account is created, you'll select a request of contribution determination. Then you'll confirm that the request is for the right person and answer a few questions to help us find your contribution history. You can also select whether you have that legal rep who helps you with medical or financial issues. If you do, you upload legal documents that show that they represent you, and we'll check your contributions to let you know whether or not you meet that requirement. Next slide. After we confirm that you've met the contribution requirement, you'll get a notification to request a time for an intake call. We use the intake call to get initial information on your care needs, set up your assessment during appointment with the WellCare's team member, share information on what to expect, answer any kind of questions that you might have. We'll also ask about whether or not if you have any language preference or accessibility needs for your appointment. Next slide. Your assessment appointment will be in person. Typically, it'll be at your home. You can ask to meet at a local Department of Social Health Services office if you prefer that. You'll meet with either a WellCare's team member from DSHS or a staff from your local AAA. You can bring 1 or more people with you for support, and we will talk with you about your help that you need for daily activities and your healthcare needs. You may be able to meet with us remotely, only in certain cases, like if you're receiving hospice care or live in a care facility and already have a plan for long-term care services. Typically, your appointment may take up to 90 minutes. Next slide. Once you've been approved, you can use your benefits to cover any covered services and supports from WellCare's provider. You may want to choose services that help you stay safely in your own home, like in-home care, home modifications, home delivered meals, or adaptive equipment and technology. We also cover many services that support family caregivers. You can get paid care from a loved one, even your spouse, or you can get respite care so they can take a break. We cover education and consultation to help them manage your care, dementia, or behavioral supports, care transitions, and coordination to support you when you leave a facility like a hospital. You can choose to receive services in your community, like an adult family home or adult day services, or you can choose to receive care in an assisted living facility or a nursing home, even including memory care. Next slide. You can get services from any provider who is registered with the WellCares Fund. To find a provider, you can visit our provider network directory. And the directory lets you find providers in your area based on the type of services that you want. Each listing will include the provider's name, services that they offer, their contact information, and additional languages that they offer. If you need help using the directory, you can call us directly as well. Next slide. You might want to compare multiple providers to find one that is best suited for your specific needs. They may have a website listed on the provider network directory that you can visit. You can also call or email them to ask for more information on the services that they offer, locations where they provide services, their availability, and their prices. You and the provider will choose and agree on details of the services that you'll get. This will include costs, dates, and times, and any other preferences or needs that you might have. Before you start to get services from your provider, you need to approve a pre-authorization. A pre-authorization is the official agreement between you and your provider about details of the services you'll get. It also helps us make sure that you have enough benefits available to pay for those services. Once you and the provider agree on details, they'll send us a pre-authorization with the info you discussed with them. You'll get a notification to log on to your online account and approve the pre-authorization. For more services, your pre-authorization will last for up to 90 days. And after that, your provider will need to send us a new one. Next slide. You'll use your online account to manage your benefits. When you log in, your dashboard will give you a quick look at the most important areas of your account. It'll show any new notifications that you need to check, any pre-authorizations for services that you need to review and approve, how much of your benefit balance you've used, and the amount that you have left. And each of those areas will have a link or a button that you can click to see more details. Next slide. You might be wondering how far your benefit amount will go. About a third of people need care for just a year or less. And for those people, depending on the services that they choose, the WellCares Fund may be able to cover all or most of the care that they need. For others, the WellCares Fund can provide your family with immediate financial relief in time to plan for future care costs. Here on the slide are a few examples how someone might utilize their benefit. If you'd like to pay a family member to care for you, you can receive 10 hours per week, 2 years, and get care supplies for around $35,000. Or if you want to make your home more accessible to keep living there independently, you can make home modifications, install a personal emergency response system, and get meals delivered for 3 years for around $36,000. Or if you need short-term help after an accident, you can get in-home care for 20 hours per week for 6 months, install a ramp, and buy safety equipment for less than $29,000. Next slide. The WellCares Fund provides a modest benefit for a modest premium. You might want additional coverage in case that you need care for longer or in a more expensive facility. The legislature created new standards for supplemental private insurance policies that are designed to work alongside the WellCares Fund benefit. This is very similar to how Medicare works. Public insurance provides a foundation of financial security for everyone. Private options are available for those who want some additional coverage. Supplemental private policies will kick in seamlessly once you utilize your WellCares Fund benefit. The supplemental market will give consumers options for coverage amounts and prices, but Policies should be more affordable than the current private insurance policies, since WACARES would cover the deductible. The policies will also have more consumer protections. The Office of the Insurance Commissioner completed rulemaking in May of 2026. Policies will become available by early of 2027. Next slide. You can also choose to continue participating in the WildCares Fund even if you do leave the state of Washington. To become an out-of-state participant, you must contribute to the fund for at least 3 years, where you work that minimum requirement of 500 hours or more per year, and must opt in within a year of leaving the state of Washington. Like other workers, out-of-state participants will keep contributing to the fund during their working years. We are working on a process for out-of-state participants to report their earnings and pay premiums with a focus on making it easy as possible for those individuals. Starting in July of 2030, out-of-state participants will be able to access benefits outside the state of Washington. Next slide. All right, this time we'll open up for the Q&A portion. As a reminder, please submit your questions directly through the Q&A function located at the bottom of your screen. If we don't have time to answer your question here today, you can send us an email or email your question using the contact form on our website.
Thanks, Logan. So I'm gonna go through and read some of these questions that you've all submitted, and we'll start getting them answered. The first question is, I have a private long-term care exemption. Am I able to opt back in?
Yes, you can opt back in. There is a period that is allowable, and that information will be found on our website.
Yeah, I can add also to that. That window started to opt back in. If you have an approved private insurance exemption, you can opt back in starting January of this year, and that will be open for a couple of years. So that window is currently available.
Thank you. What are the options for self-employed workers, and when can they opt in?
Yeah, self-employed workers can opt in at any time. I mentioned on our slide, go to our WildCares Fund website for information that will direct them to the Employment Security Department to opt in.
Thank you. And yeah, I'll just add to that. So self-employed can opt in at any time within the first 3 years of becoming self-employed for the first time. And then are benefits paid directly to a family member who provides care, or are they paid to the beneficiary?
The benefits will be paid directly to the beneficiary itself. Sorry, to the provider itself.
Can you go over the new transition pathway again?
Sure. Yeah, so the transition pathway is for individuals that were born before 1968. To put it really simple, individuals started contributing in July of 2023. For each year that they pay into the fund, they earn 10% of the fund. So if they work and contribute for 2 years, they'd earn 20% of the fund, which is roughly around $7,300.
Thank you. What is the contribution rate?
Contribution rate is 0.58% of every paycheck.
And does that amount change, or does it stay the same?
That amount will not change. It will stay the same.
Am I able to add somebody to my account to help me if I'm not savvy on the internet?
Yeah, so you can work directly with us at the DSHS as well. Then you can also work with your local area agency on aging as well to help you create an account.
How am I able to see my contributions?
I'll defer to that one to you, Sam.
So in order to see your contributions, you can request a contribution determination letter, and I will drop the link in the chat for you all so you can do that if you're interested. You can also look at your pay stubs and see when your contributions started and estimate how many contributions you've made so far. How do you qualify for benefits? Should young people sign up to be part of Law Cares?
You don't need to sign up if you're over the age of 18 and employed in the state of Washington. You're automatically enrolled by your employer.
Um, what are the qualifications to be approved for benefits?
Yeah, so an individual has to have at least 3 activities of daily living and then a care need more than 90 days to qualify.
Is the total benefit amount one time, the total amount for services, or a lifetime total?
Yeah, it's a one-time usage. Currently, it's $36,500. As I mentioned before, that number will continue to increase over time with inflation, but it is a one-time use.
Can I use my benefits outside of Washington?
You can use your benefits outside the state of Washington if you become an out-of-state participant.
Um, what is the process after I apply? What are the next steps?
Yeah, like I mentioned before, we'll do a care needs assessment to see if you potentially qualify, and that will possibly include the in-home assessment as well.
Um, how long does it take to schedule my assessment and to have my assessment?
Typically, the assessment will be around 90 minutes.
Sorry, I'm just going through these questions. When will through that one? How can I find a registered provider in my area?
We have a provider directory, and we can put the link to that. It's on our website in the chat.
Where can I get more information about paid family caregiver training?
Sam, I'll defer to you on that one.
You can go to our website. I'll drop the link in the chat, and there's information. The training requirements are different depending on if you're employed by a home care agency or by CD WA. requirements are a little bit different. So depending on which path you take, there's more information here. What happens if you retire um, before you meet one of the pathways for the full benefit?
Yeah, so for an individual that would retire before the year 2023, would not receive any benefits because they have not paid into the fund.
What if they retire like in 2 years from now?
Yeah, so if they retire 2 years from now, they'd be paying into the fund roughly around 5 years or so. So they'd earn 50% of the fund. To qualify for that full benefit amount, you need to pay into the fund for 10 years.
If I have a conditional exemption because I moved out of state, will I still be eligible to re-enroll in the program if I move back in the state or something else changes?
Yeah, so given that scenario, if you did move back into the state itself, you would be automatically enrolled to contribute to the fund again.
Where can I find cost limits for how much I am able to spend on approved services?
I'm not aware of any cost limits, Sam. Are you aware of any cost limits?
Yeah, so there is a maximum rates sheet, which I will put the link in the chat, and you can see on there what the maximum rates are for each approved service. Um, if I stopped working in 2022, would I qualify?
No, you would not qualify. Like I mentioned before, contributions started in 2023, so any individual that is not paid into the fund will not qualify for the fund.
Am I able to use my benefit in pieces? For example, can I use 20,000 now and then the remaining 16,500 later? Or do I have to use it all at the same time?
I'm going to defer to you, Sam, on that one. I know there's a few different specifications.
Yeah, so you can, it's a lifetime benefit amount, so you can continue to use your benefit over time until your benefit is exhausted. When did automatic contributions start for employees?
That was in July of 2023.
There's still some confusion on the transition pathway. Can you maybe pull up the slide and go over the pathways again?
Sure. Sebastian, you want to pull up there you go.
Yeah, sorry, I'm gonna scroll back. So sorry for the quick screen changes.
Yeah, so we'll just go through this one more time here. So everyone who's contributed to the Walk Cares Fund more than 500 hours per calendar year is earning those benefits. So that includes those part-time workers, those temporary workers. To qualify for benefits, you need to meet those contributions requirements through these three different pathways. And so the first one is what we call the permanent pathway. And like I mentioned before, this will earn you lifetime access to that full benefit amount of $36,500 by paying into the fund for 10 years. The next is what we call the temporary pathway, and this will earn you access to that full benefit amount if you contribute to the fund for at least 3 of the last 6 years, the time that you apply for benefits. As mentioned before, this was designed for people who've contributed recently at the point where they need care but haven't earned that permanent access yet. In 2026, applicants who contribute for 3 years at any point in the program can qualify through this pathway. And then finally, we have what's called that transition pathway, and this will earn permanent access to 10% of the full benefit amount for each year that you contribute. So again, if you were born before 1968, for example, you would contribute for 2 years, you'd earn 20% of that full benefit amount, or roughly around $7,300. And this was designed for people near retirement as the program launches who might not be able to earn through that permanent access pathway by contributing to the fund for 10 years.
Thank you. If I am denied benefits, what can I do?
I'll defer to you on that one, Sam.
Yeah, so if you're denied benefits, there is a reconsideration process, or you can request an administrative hearing to appeal your denial. And I see some messages that say that you can't see the chat. Are you still unable to see the chat? Can somebody just put in the Q&A? Okay, yeah, someone said you can. Okay, great. So I had dropped the link to the toolkit in the chat, and to our benefit denial determination in the toolkit, and that explains what your rights are. If you purchase something that exceeds your benefit amount, does the client have to pay for the remainder? Is the next question, Logan.
I'm not entirely certain on that one. I
Yeah,
know.
so
Go
if
ahead.
purchase exceeds your benefit amount, you will be responsible for paying the additional cost. There are some questions about the assessment. Can you go over the assessment process again?
Sure. All right. Yeah. So, like I mentioned before, that assessment appointment will be generally in person, typically at your home. You can also ask to meet at a local Department of Social Health Services office, if that's something that you prefer. You can also either meet with a Walk Here Fund team member from the DSHS or a staff from your local area agency on aging as well. And you can bring one or more people with you to support you, and we'll talk about help that you need during those daily activities and your health care needs as well. You may be able to meet with us remotely in some certain cases, like individuals that are currently receiving hospice care or living within a care facility and already have a plan for long-term care services. And like I mentioned before, typically this appointment will take up to 90 minutes.
Can you talk about how a veteran might qualify for the program?
This is not in regards to exemptions at all.
No, I think they're just asking for a scenario about how a veteran would qualify, but they would qualify the same way that anybody qualifies for the program. So they would have to meet contribution and care needs requirements. If you are a veteran with a 70% or higher service-connected disability rating, then you could have a conditional exemption from the program. But or if you're an active duty service member with an off-duty civilian job, you could have an exemption. But if you don't have an exemption and you have been making contributions, you would meet program requirements the same way as anybody else. If you retire after 10 years of contributions and you meet multiple pathways, will you get the full benefit even if you're born before 1968? Or if you are born before 1968, do you have to do the um, new retiree pathway?
No, individuals that were born before 1968, if they continue working and they pay into the fund for 10 years, they'll earn access to that full benefit amount of $36,500.
Um, is there a long wait to get scheduled for assessments, or is it a relatively quick process?
Sam, you probably answer that one a little better than I can.
Yeah, so right now there aren't long delays for scheduling your assessment. The intake team will contact you and get you scheduled, and depending on your availability, it is a relatively quick process to get on the calendar. Um, if you have specific questions about um, data or the number of providers or anything like that, you can email us your question and we can get back to you in writing. You can fill out this form on the contact page of our website and we will get back to you. Can you go back over the contribution determination process?
Sure. If you want to pull that slide up, Sebastian. So they have a question on the pathways again.
It's about the contribution determination letter and how to get that and what part of the process that's in.
Is that the right slide there, Sebastian?
Yeah, sorry, it's been a little laggy on
Oh,
my
you're
end.
good.
I believe it's further ahead. Here we go.
All right, let me pull it on my end here.
And I can jump
Sure.
in.
Yeah, if you can do that, Sebastian.
Yeah, so once you've created your Walk Here's account, then you'll be able to see on your account a button to request a contribution determination, and that'll be how we confirm whether you've met right that contribution one of the contribution or met the contribution requirement through one of those pathways that we reviewed. So that would be kind of the first step in getting that contribution determination. And then after that, we'll notify you, of course, of the if you've met that contribution requirement.
Great. How do can you talk a little bit about program solvency, Sebastian?
Sure. Yeah. So we work with the program is projected to be solvent for a period of 75 years. That solvency and that projection is assessed every year. So every year that's reviewed. And so again, it's projected to be solvent for the next 75 years.
Great. Do you have any information about how supplemental private long-term care insurance will work with walk cares?
Yeah. I know we shared a little bit in the slide, but we do have a one pager on our website that covers the supplemental private coverage. So I would definitely encourage looking at that material. But essentially, as we kind of mentioned, right, when someone exhausts their walk years benefit, they'll have the option to purchase these supplemental policies to continue right receiving services once again they've exhausted their walk years benefit.
Great. Where can I find a list of services that are covered and descriptions?
Yeah, those would also be on our website. We have the full list of covered services. We also have kind of snapshots of each service as well individually, but you'll find that full list on our website on our covered services page.
Um, there's a few more questions about providers specifically. If you can submit your question through the online form and we can get those questions answered by the provider team, that would be great. Um, Somebody is looking for a definition of long-term care. They said that they thought it was people who are living in a nursing home already. How is this going to help me if I don't need to be in a nursing home?
Yeah, no, thank you for that question because I think that's definitely something that a lot of people think initially that it might just be nursing home or something of living in a facility. But long-term care is needing help with activities of daily living, and those activities are bathing, eating, medication management, mobility, right, toileting, bed mobility, right, so getting in and out of the bed. And so, if someone needs help with those activities, then that would mean that they likely have a long-term care need. In terms of our functional eligibility, right, someone needs help with three or more of these activities of daily living. And what also makes it long-term care is that they need help for at least 90 days. So, right, for a longer period of time. So those are kind of the two pieces to our functional eligibility.
If I qualify for another long-term care program and have already done an assessment with them, do I have to redo my assessment for walkers?
Yeah, so if it's for a different program, then you will have to do the Walk Cares assessment with a Walk Cares staff member who will conduct that assessment.
Um, if I only work part-time, am I still meeting contribution requirements?
So yeah, it's the as long as you're working at least 500 hours per year, then you are earning benefits. So that can be if maybe, if it's seasonal work, right, you can work more part of the year and less in the second half of the year, let's say, or if it's part-time work, maybe, at least 10 hours per week on average. So as long as you're working 500 hours per year, then you are earning benefits.
And follow-up question to that, when you say year, is it a calendar year?
Calendar year, yeah.
It looks like we're getting to the last couple of questions. I'll give folks a few more minutes if they want to add anything. If there's a question, do family caregivers qualify for health insurance if they're working more than 40 hours a week? And that depends on your employer. If you're going through CDWA or home care agency, requirements will be different or opportunities are different based on your employer. Can your paid family member be your spouse?
Yes, yeah. So your spouse can be your caregiver. Yep.
That's looks like we answered most of these already. If anybody has any last questions and you want to add them at the newly, that would be helpful. Is the contribution amount on gross wages or net wages?
It's on gross wages.
And then there's a question about becoming a paid family caregiver. I will respond to you with a link. There's a question about vehicle modifications. I can send you some information on that through our service snapshot. Any other questions?
Sorry about that.
Okay. I think we are good to move on. So, oh, there is a question about the slides,
Yeah.
if they'll be available. They'll be added to our website on walkersfund.wa.gov. Later this afternoon, you'll be able to find the slides and a recording of today's webinar available on the website. As soon as you exit out of today's webinar, there will be a survey that will pop up on your screen. We would love to hear from you. We value your feedback. If you'd like to share your thoughts, please take a minute to complete our short survey. And then next slide, are on social media, Facebook, Instagram, and LinkedIn. You can follow us on there for the most up-to-date information. You can also sign up for emails. And as I mentioned earlier, webinar materials will be on our website at wildcaresfund.wa.gov/webinars. There you will also be able to see all of our upcoming webinars. Later this month, we have a webinar about building a support system. And then next month, we do have a webinar for providers to do a deep dive into Provider One. So if you're interested in that, I saw some questions about Provider One. That might be a good one to sign up for. And if you have any additional questions that we weren't able to get to during today's presentation, you can contact us by email or live chat on our website. If you have questions about exemptions or you are an employer and have a question about reporting, you can contact ESD at the phone number on the right. Thank you all for joining us today, and we hope to see you in the future for other webinars.